forward, there is a need to look at how we can further utilize the nursing profession, both as in the area of leadership, but also in the terms of how they can be better healthcare providers. And I think now with changing times, we are looking at changing roles that would be there as far as concerned. And there is also a need to see how we can incorporate technology and training for nurses of the future. We have to look at nurses who are more specialized, whether it be critical care, nurse practitioners, or in various other areas which could be community based or could be based in hospitals. This is something that needs to be done. With that, nurses will become lead and be able to show how comprehensive health can be provided by all healthcare workers coming together in terms of using the latest technology that is available and providing good quality healthcare, even in areas where there is resource limitation. Therefore, I think there is a need for all of us to get together and see how we can use this theme that is there for this year as part of the really make the nursing profession better and see how we can have nurses for the future. I would like to take this opportunity also to really congratulate and acknowledge the contribution of the nursing profession, even subsequently. And I know that these have been trying times. We've lost many of our colleagues during this pandemic. And despite all the hardships, we have come out victorious and have been able to really get a hold of the pandemic. So congratulations and my best wishes to everyone on this International Nurses Day. Thank you.
AIIMS का पड़ेगा। इसके बाद शेयर करना।
Nursing Day is celebrated globally.
Introduce.
Now we'll have a message.
अपना बंद किया है। इनको अपना माइक बंद रखना उसमें। कभी ज्वाइन नहीं
और किसी का ज्वाइन है क्या इधर?
माइक
Google Meet पे join करो।
गूगल मीट इधर किसी ने ज्वाइन किया गूगल मीट? एक तो ऑफ
Now we'll have a message from our now we'll have a message. Share करने के बाद
कौन सा होगा?
वीडियो फाइल शेयर है ना वीडियो में आवाज नहीं आ रहा था आपको जब मैंने शेयर किया उससे आवाज जाएगा स्पीकर को करके तुम करना वीडियो उसके बाद मैसेज नहीं जाएगा ना।
Around.
फिर भी सिटी को दे।
You can do all the messages little later. We will start with the physical. Once we are all right, we'll do it. We'll start with the.
आप वीडियो करेंगे।
मना कर रहा हूँ। पहले तो वैसे show।
It is my proud privilege and honor to introduce the keynote address speaker. I would like to invite Dr. Lata Venkatesan, Professor cum Principal, College of Nursing, AIIMS, Delhi. Dr. Lata is a dynamic and proactive leader, a visionary, and has been having untiring zeal as a disseminator for knowledge, for capacity building of the nursing fraternity all across the globe. She has exemplary contributions to the profession in various capacities. To her credit, she has been a pioneer of many nursing colleges of Apollo in India and abroad. She has been on various boards of different universities. She has n number of publications and citations in reputed journals. Over to Dr. Lata Venkatesan for the keynote address. Thank you.
स्टॉक शेयर करो। स्टॉक शेयर करो ना ये। अब होगा शेयर गूगल मीट पे जाओ।
University School of Nursing, USA, and Miss Meeravati PS, the nurse educator from Singapore. And we do have another guest who will be joining us physically, that is Mr. Missa Shadan, Senior Manager from Global Health Strategies, Delhi. And we already have Dr. Mansingh Sidhu, the Counselor of Science, Technology and Higher Education from Royal Norwegian Embassy. So once again, a warm welcome to all the resource speakers, and I am here to speak on the theme of International Nurses Day. May 12th is observed as International Nurses Day across the world to honor the services of nurses. And it is also the birth anniversary of Florence Nightingale, who was the English social reformer, statistician, and founder of modern nursing. Every year, the International Council of Nursing announces a theme. So, the activities of nurses across the world throughout the year is focused on a single theme. And many hospitals observe different kinds of activities, including walking in the shoes of nurses and spending one day observing how the nurses are working in the hospital. Poster competitions and various other competitions are organized. And we have organized this symposium to listen to the global health strategies which are adopted by various organizations to strengthen nursing. And every year, International Council of Nurses releases a kit called IND kit, which gives all the strategic plans, initiatives, and how to observe the year with the planned activities. But this year, it is released only today. So we do not know what is the guidance and activities suggested by International Council of Nursing. But I felt it is worth reviewing what International Council of Nurses has done, especially during the year 2021. The theme of the year, that is Invest in Nursing, was started as a 5-year plan between 2019 and 23, and it has got four major goals, that is global impact, membership empowerment, strategic leadership, and innovative growth. And as part of the goal number 1, global impact, it was so interesting to read how much the International Council of Nursing has worked and contributed to our profession. ICN took an active part in the development of WHO Global Strategic Directions for Nursing and Midwifery. In short, it is known as SDNM. And this report was published with a 5-year plan uh, for implementation between 2021 to 2025. And ICN resources for leadership, jobs, service delivery, and education were made available in the website of WHO Nursing and Midwifery Global Community of Practice. In short, it is known as WHO NMGC, Global Community of Practice. It is a network of nurses across the world to learn the impact nurses create on the global health agenda. And we all must become members of these kind of networks. And World Health Alliance 2021, in which ICN also made their statements on global action for patient safety, immunization agenda for 2030, COVID-19 response, health workforce and their concerns, mental health preparedness and response for COVID-19 pandemic. And World Health Professional Alliance is a unique alliance of International Council of Nursing, World Medical Association, World Physiotherapy, International Pharmaceutical Federation, and the World Dental Federation. And few samples of the significant work done by ICNR, they they did advocacy for vaccine equity for all frontline workers, stand up for positive practice environment campaign to safeguard the health and well-being of nurses, and Voices from the Field, which was an interview series of real life examples of nurses, which was showcased throughout the year. And ICN also was part of the Nursing Now Challenge. The Nursing Now Challenge was the global campaign which was started in the year 2018 and it ended in 2021. And now also it is continued by Birdet Trust. They only initiated this Nursing Now program, and they would like to train 1 lakh nurses and midwives in more than 150 countries by 2022 in leadership development opportunities. And ICN also has created the Girl Child Education Fund, which is known as GCEF. And International Council of Nurses, along with the Florence Nightingale Foundation, they wanted to support the primary and secondary education of children less than the age of 18 who lost either a single parent or both parents due to COVID. And the ICN goal number 2 focused on membership empowerment. And as part of membership empowerment, also they have done a lot of activities. They introduced many awards, and some awards were already existing and some were introduced newly last year. They are ICN Innovation Awards, Christian Raymond Prize for Outstanding Nursing Achievement, Health and Human Rights Award for recognizing truly humanitarian contributions, and Kim Mo Aim Policy Innovation and Impact Award, Partners in Development Award for the NGOs and foundations which contributed to the welfare of nurses, International Achievement Award. These were all the awards which were given by ICN in recognition of the services done by nurses and whoever is supporting the nursing services. And they also, interestingly, they also have some initiatives for nursing students. So the students here, you can be part of these initiatives. That is ICN Student Steering Group, which in short is known as NSSG, to support the work on student engagement at ICN and global nursing policy. So see, they are grooming even students as leaders to be part of the ICN global policy making initiatives. And ICN Nursing Student Assembly, you can become member of the ICN Student Assembly, so you will get opportunity to interact with the students from other countries and with the leaders in nursing. And as part of the membership empowerment, they also have strengthening of national nursing associations. Already more than 130 national nursing associations are members of International Council of Nursing. Indian Nursing Council is also a member of International Council of Nursing. And they started a program called as ODENNA, that is Organizational Development of National Nursing Associations, and they launched newly revised ICN Code of Ethics for nurses. I think we have all have learned part of our nursing foundations or history of nursing, the Code of Ethics that has been revised in the year 2021. And they also have a collaboration with World Continuing Education Alliance, which is known as WCEA. And our TNA also has partnered with this WCEA. It offers free courses in various disciplines related to nursing. And so all the professional resources are made available freely for the nurses everywhere through the association with WCEA. And they also have done advocacy and lobbying for professional issues in various countries. And they have a fund called ICN Humanitarian Fund, which is mainly used for disasters. And they consider COVID as a disaster, and the disaster fund was released for helping nurses working in disaster areas, especially where there was a pandemic of COVID, which affected the public largely. And ICN Goal 3 focuses on the strategic leadership. So they started an institute which is called as GNLI, Global Nursing Leadership Institute. And they have started a strategic policy leadership program. And this leadership program will help the nurses to focus on achieving the SDG goals. So they are connecting nursing leadership with achievement of SDG goals. They have selected 2 times the GNLI program was conducted. They have selected around 30 nurses from various countries and offered them this leadership program. And subsequently, they want to utilize them to interact with the international agencies like WHO, UN, UNICEF in developing policies related to nurses. And they also have a program called Leadership for Change, LFC, which was started in the year 1995, and it aims to prepare the nurses with the leadership skills acquired to implement organizational change and better health outcomes. And our Indian Nursing Council has tied up with the International Council of Nursing, and they are offering this LFC program now. Batch 1 was selected with 20 nurses, and the second batch with 20 nurses they have selected, and they are being offered LFC program leadership change, for change, and they are supposed to bring some changes in the organizations where they are working. And ICN certified global nurse consultant, CGNC, this is also a new initiative of ICN, and this new program will enable ICN to identify and certify a body of accomplished nurses who will form a powerful resource of specialists to address the increasing demand for expert nursing advice worldwide. So these are all the 3 major programs which INC has designed and implemented for grooming the leaders among nurses. And they also strengthen the advanced practice nursing as part of the strategic leadership program. So they have publications. They have published series of guidelines for advanced practice nursing, because usually nurses means they will show the syringe, medicine, or thermometer, BP apparatus. I think the role of nurses is beyond that. We handle various gadgets, and whatever latest gadgets come into the field, nurses quickly adopt without even undergoing an appropriate training. Let it be a heart and lung transplant or other organ transplants or robotic surgeries, any newer technology which comes, advanced practice of nurses is required, and nurses are highly resilient to adopt to these changes. So they have released a series of guidelines on advanced practice nursing, and they also released new guidelines last year. Two new guidelines were released last year. That was guidelines for nurse anesthetists and guidelines on prescriptive authority for nurses. Even in other forums, some people were describing or discussing that no, we are not writing any prescription, but everybody writes prescription. A dietitian writes prescription for diet, a physiotherapist writes prescription for what kind of exercises to be done. But as nurses, we are not prescribing nursing care. Prescribing is not only drugs, even the care aspects can go on prescription. So this is a newer a thought which is coming up, and the world is focusing on bringing guidelines on nurse prescribing. And even in Indian nursing curriculum, the revised curriculum has included nurse prescribing module, and we are still awaiting the content from the council. And they also published new books which are known as which are clinical nurse specialist role and practice and spiritual dimensions of advanced practice nursing. These two books were released last year, and of course they have several publications which was done during the previous years. And they also have started ICN Nurse Practitioner Advanced Practice Nursing Network. So their 11th conference was held, and the second largest study in the world on resilience of advanced practice nurses during COVID was conducted by ICN. So, and their goal 4 focused on the innovative growth, and as part of the innovative growth, they have brought in international classification for nursing practice. So we have international code for diseases. So here international classification for nursing practices, which is in short known as ICNP. This was launched in 1999 and revised every 2 years. And last year the revision was done. And it provides international standards for describing the nursing practices and also compare the nursing practices between the countries. And they also are very active in the media and social media. There is a YouTube channel for ICN. There is a monthly blog in which various issues are discussed, and they have partnership with BBC television. And part of BBC, they have signed an MOU for 12-month campaign of series of video films which will be showcasing the global nursing workforce. And they also have a publication which many of us know, which is known as International Journal of Nursing Review. It is a quarterly peer-reviewed journal. So now this year theme is invest in nursing and respect rights. So it is now time for the governments and health systems to invest in nursing education, address the growing nursing shortage, provide positive practice environments and adequate remuneration, ensure gender equity, and involve nurses in decision making at all levels in all aspects of health and healthcare. Nursing is the solution to address the world's growing healthcare needs. Investment in the nursing workforce means we can restore, transform, and strengthen the health systems to ensure health equity. So, by investing in nursing and respecting rights, we can build a stronger, more resilient, competent, and satisfied nursing workforce to meet the challenges ahead. So, to conclude, the pandemic has shown us only too clearly that we need a real investment in the profession of nursing in order to secure global health, and nurses' rights, safety, and well being must be protected as well. So, despite working through challenging circumstances, nursing staff around the world continue to go above and beyond to deliver highly skilled, safety critical care to patients every single day. So the world has changed, but our dedication has not. So thank you for all the nurses, and once again wish you all a very happy International Nurses Day. Thank you.
Thank you very much, Ma'am Principal Dr. Lata Venkateshan, Professor cum Principal of College of Nursing, AIIMS, New Delhi. I remember your last second last slide, in which says that not all angels have wings, but some have stethoscopes. So it had very well summarized the goals of the International Council of Nurses, like membership, empowerment, global impact, and nursing advanced practice, and this leadership. Thank you very much, ma'am, that you have very beautifully brought up these, explained this theme of the International Nurses Day in these four goals. And we have come to know that this that INC, that is Indian Nursing Council, has tied up with this ICN, International Council of Nurses, for different leadership programs, and maybe in the leadership change, or for the leadership opportunities, or for the leadership tied up, and how the investing in nursing can bring about a change in the nursing profession itself, including the competency in the nursing and the leadership in the nursing and global impacts. Thank you very much, ma'am, for the beautiful explanation of the themes. So may we proceed with the permission of Madam Principal with the further program, or we would break here? Dr. Sidhu's. So may I call upon Dr. Mansingh Sidhu, Counselor for Science, Technology and Higher Education, Royal Norwegian Embassy, Delhi, for his talk on Indo-Norwegian collaboration opportunities for nursing. Sir, please.
दो अब रहने दो सर, इस पे जाओ, मैं बता रहा हूँ, इस पे जाओ, विंडोज पे जाओ सर। स्लाइड तो खोली ना, ये कहाँ से जाएगी? इसको करो ना, मैडम वाली हटाओ, बंद करो पहले। जो मैडम वाली थी वो बंद कर दो। अब जाओ उस पे, गूगल मीट पे। हाँ ये रही ना, ये रही, इस पे शेयर करो, इसको स्लाइड शो पे कर दो।
Okay. Yes. Good morning to everybody. First of all, I would like to say congratulations to all of you on this International Nursing Day. Although I'm not have nursing as a field, but I have been have heard a lot about Florence Nightingale previously. So, and I will also say thank you to AIIMS College of Nursing. Thank you to Professor Dr. Randeep Gularia, Dr. Lata Vikitson, Dr. Deepika Khakha, and faculty members, students, ladies and gentlemen. I'm very much honored to be a part of this international celebration of Nursing Day today. My role is actually to strengthen the Indo-Norwegian collaboration. And I will just go through and highlight my mandate in India and how we, in the coming days or coming months of in the years, we can at least do some kind of collaboration with AIIMS India and Delhi. So I will highlight all those things. I have got several mandates. Mandates from the Research Council of Norway, which is the funding agency, and it covers all discipline, including global health, nursing, as well as clinical approaches, whatever is needed, both innovation project as well as innovative as well as scientific projects. So we also provide funding for the research community as well as for the industry partners there. And I'm also representing the Innovation Norway. The Innovation Norway is also a funding agency which promote like collaboration or promote Norwegian business within Norway or outside Norway. So, and third is the organization what I'm representing here in India is the Norwegian Directorate for Higher Education and Skill. And this is very important for, I guess, for you guys, that how we can enhance the quality of education and skill through involvement of Norwegian Directorate for Higher Education and Skill. We have been talking to Professor Lata small previously in some of our meetings that how we can enhance this quality between some of our Norwegian universities, some of our Norwegian hospitals together with AIIMS, College of Nursing. And I'm very much looking forward in the coming days to explore more opportunities together with the College of Nursing together. And also we want to strengthen the international collaboration with you. So actually these three are the funding agencies where I have the mandate. I am representing these agencies in India, as well as a counselor for science, technology, and higher education at the Royal Norwegian Embassy in Delhi. So I'm also trying to facilitate or strengthen ongoing collaboration with the Indian as well as Norwegian ministries. At this moment, we have got several MOUs with the Indian ministries, like Department of Science and Technology. We have a ministries collaboration in bilateral collaboration with these. And we have Ministry of Earth Sciences. We have ICMR. Recently, a couple of years ago, so we did one bilateral call with ICMR in the field of antimicrobial resistance. And few of the projects were funded bilaterally. And we got very successful outcome of these results bilaterally. And we are also looking forward to how this could be strengthened in upcoming years together with different ministries where health sectors can be involved very much in the collaboration. How actually we coordinate in India or across the world, I would say. We believe in a knowledge triangle. If you see the knowledge triangle, it is like triangle where the three basic elements like research, innovation, and higher education is the basic principal aspect where we're trying to make a bridge between all these three aspects. So if you miss any of these three, so there is something missing, then you will not approach, you won't be able to get the aim of the collaboration. Because however, if you have like some kind of scientific results and you don't have the implication of those results in the society, so it will be like a bit challenging. You will have some kind of challenge. So our basic aim is the scientific results, and that should be implemented in the society through industry involvement. So this is how we are working in India, and we are very much focused and dedicated and committed how this could be done with collaboration with universities, with research institutes, as well as involvement of industry people. So at this moment, we have 4 science and technology counselor across the world. I'm in India, and I have 3 more colleagues, one in Brazil, one in Japan, and a fourth one is Singapore. So we are collaborating very much closely with each other and finding and try to promote Norwegian interest in the world, and Norwegian technologies, Norwegian innovations, Norwegian infrastructures, Norwegian strength, and how this could be beneficial for global society. We are very much focused on that, and we are working very much together with our global partners, as well as Norwegian partners from industry as well as universities. So we have at this moment one strategy, Norwegian strategy called Norway India 2030 strategy. And Norwegian government, they have already identified few of the prioritized area of cooperation. And if you see that the global health is also one of the priority area for Norwegian government. And having said that, we have mutual interest. We have mutual things to collaborate with, and let's see how this could be promoted in the coming days through research and education involvement, as well as industry involvement. At this moment, we have 120 Norwegian business already established in India. I would say Lærdal, you have heard about this Norwegian Lærdal company, and many more Norwegian company are also in India. And all these Norwegian are very much dedicated to contribute to SDG goals, as well as to solve the global challenges. I have been talking to some of these Norwegian companies, and they are very much interested that how, if Norwegian students are coming to India, and how can they bring these students to their campus, their office, their production houses, so that these Norwegian students can at least learn the innovative cultures, how innovation can be carried out, how innovation is discussed when the industry people sit on the table and find some solutions. So this is very important thing for the students to learn, not only the books, what is mentioned in the books, but how actually the outer world is functioning. So this is a very important thing we are working at this moment. This Norway 2030 strategy this was launched 2.5 years ago by the Norwegian government. And beside those, we are also working in the oceans areas, because both Norway and India have identical, like similar. We have broad ocean part. We own, both India and Norway have broad area where we can do something together. Renewable energies is an upcoming challenge for all of us. We are also trying to find how this could be optimized in a better way. Climate and environment, this is a very big issue in front of us. You know that. Taking like COVID situation, during this COVID, so we have a lot of disposables from the health sectors, and how this could be utilized in a better way, reuse, circular economy, zero waste. So these are the things we are also thinking in all disciplines, not only in some particular sectors where it is useful. So we are trying to implement those strategies in India as well. We have another strategy called Panorama strategy. This is a government strategy for higher education and research cooperation, and these strategies have some priorities like connecting higher education, research, and innovation cooperation, as I mentioned in my knowledge triangle part. Good interaction with business sectors, as well as student mobility. And we are very much looking forward to take some some students from College of Nursing to Norway and provide some kind of platform to learn how they can learn from our students, our faculty, our universities, and vice versa. And this I'm very much looking forward to discuss with Professor Lata after this meeting to explore some more potentials between Norway and India. Also, that interacting bilateral and multilateral cooperation is also important, and research-based knowledge to achieve UN SDGs goal. These are the 5 priorities mentioned in this Paranoma strategy. And this Paranoma strategy is like Norwegian government has identified 9 prioritized strategic countries across the world. And I'm very happy to announce that or say or highlight that India is one of the 9 strategic partner for Norway, and along with different other countries across the world. And this means we are very much committed. We are very much looking forward to collaborate with the Indian partners or Indian stakeholders wherever it is applicable, wherever we have like mutual interest. And another thing that is important for today's meeting is that we have another white paper on international student mobility in higher education. And this was launched in October 2020, 1.5 years ago. And the aim is to strengthen the quality and relevance of higher education. At this moment, we have, or I would say that the Norwegian government has ambition, a huge ambition, that at least their aim is to have 50% of Norwegian students, they should bring their studies outside Norway. They should go abroad and have some kind of training. They should go abroad and have some higher studies. And this is a very big figure, I guess, because at this moment, only 18 to 20% students going abroad, Norwegian students going abroad. So this is a big ambition, which provide us, of course, a good opportunity and huge opportunity for us to bring Norwegian students to, for example, AIIMS Delhi or some other stakeholders or the other Indian universities in India. So we have very much good backgrounds. We have very much solid strategic documents to build upon our collaboration in the futures. These are the important thematic areas for future collaboration. I think for you, like ICT and health block, if you see that part, enabling technologies, artificial intelligence, AMR, food safety and security. Food safety is also part where I think you play a very important role when it comes to microbial contaminations and some kind of digestive disorders and due to unsafe food. So these areas could be also very important to explore how what are you doing now and your ongoing activities can be implemented if there is anything we can do together. So that can be explored for future cooperation. Some of the areas are like, I think, to my knowledge, it's not so relevant for you. But I think there are some other areas where certainly some relevance I can see here. So these are the pictures I have taken when we received 40 Norwegian students, nursing students. They came this year, and they were for training for 3 months in India. We had a collaboration with 2 different universities, one in North India and second was in South India. So and after they completed their training and higher studies, so we invited these 40 students, and Professor Lata was also invited in that meeting. And we asked about their experiences and what they have learned during their stay in India. So, I was very much surprised that most of the students were very positive. They were so much happy, and most of them, they said they are going to be a good ambassador of us, or like they are going to send more students to India, nursing students, I mean. And this is a good feedback for us. It means there is a lot of interest for Norwegian students to come to India and to learn how you provide platform for them to learn, what kind of infrastructure you provide, because India is a huge country, and based on huge population, I guess there is a lot of other challenges. What Norway being just 5.2 or 5.3 million population, we cannot get all kind of like challenges there. So I think we have a good opportunity where India is providing for us to learn, to provide our students to learn some innovative cultures, some innovations, some technologies, some new challenges, and this could be, of course, taken forward in our collaborations. Before that, I will also mention one thing that we are expecting some professors, some university delegations coming from Norway in the month of June, and we have already made an appointment with College of Nursing, AIIMS, and I will be very happy to take that delegation for a visit to your campus, to your faculty, and to learn mutual interest, or to explore mutual collaboration possibilities in June. And I hope that this will provide us some, or open some window for a collaboration in the future. This is like we have started one Nordics in India project. This is a collaboration between 4 Nordic embassies in India, Norway, Sweden, Denmark, and Finland. And this is a project funded by the Nordic Council of Ministers. And in this, we are going to have India-Nordic Innovation Partnership in carbon neutrality and sustainable circular bio-based economy. Circular bio-based economy is a very broad thematic area. This implies in different disciplines, including health sector, because there are a lot of things in the health sector get disposed without any return back to the circularity. And we are looking for zero waste in the health sector. How health sectors, disposable things, gloves, masks, and many things like beds and all those things, infrastructures, how this could be again reutilized in an optimal way, so that we can minimize the waste of from the hospitals. So this is also one of the area where we are also looking forward in this. So in this project, so we have aimed one high-level policy dialogue meeting between India government and Norwegian government, and that we had in January. That was successful meeting. Followed by that, so we are planning 2 workshops, one in Pune on 26th of May, and on 27th, we are having another workshop in Bangalore in 27th of May. And we have invited like speakers from 4 Nordic countries, Norway, Denmark, Finland, and Sweden. And we will discuss mutual interest. And also, we have also invited stakeholders from India, industry people from India. And we will sit together. This is a kind of workshop, and we will sit and explore and discuss what are the challenges both India and Norway researchers are facing in different disciplines. Of course, health sector is also an important area, needs to be discussed and explored. And based on that, we will publish a report. And I guess and I hope that this report will provide some platform for bilateral call in the upcoming years between Nordic or India, or Norway and India, whatever. This will provide some funding opportunities for India-Norwegian collaboration. So this is that, and this is like if you see here, health sector. This is the slide where I'm trying to highlight collaboration between Indian partners or contracts with the Indian partners when it comes to Horizon 2020. I'm not sure how many of people you have you know about this Horizon 2020. Is it okay?
Yeah.
Okay. Yeah. This Horizon 2020 is the world's biggest research and innovation program. Uh, uh, by the this is administered by the European Commission in Brazil. So this is over. This was over last year, and they have started a new program. This is called Horizon Europe that was started last year, and this will go for the next 7 years again. So based on that previous framework program, so and this the statistics shows up to May 2020. So this is not updated. I'm sorry for that, but based on the statistic what I have received from until May 2020, so 37 contracts have been signed between Norway, where Norway and Indian stakeholders have common projects or like collaborative projects. And of this, so I'm very happy to share that 7 projects were in the health sector. So it means there are a lot of interest, and this interest needs to be motivated more in the years. And I'm not sure what is the current status when it comes to the Indian participation in the upcoming Horizon Europe participation. If will be any co-funding from Indian government at this moment, this is not confirmed, or to my knowledge, I'm not sure. But if this happens, so it will again open some opportunities for you to make some joint calls together with European colleagues, including Norwegian colleagues, and apply for funding. So this is what we offer, like collaboration opportunities from team in Norway in India. So we are the advisors. We provide guidance, and we provide funding opportunities and guidance for that. We can help to take dialogue with government partners, both from Indian side as well as from Norwegian side, according to relevance. We also provide some platform for new agreements of or MOU signing, or follow up on the signed MOU agreements. That is also our part. We also provide platform for delegation visits to promote and explore science, technology, higher education collaboration. This is when I say delegation visit, it is like both ways, from Norway to India and from India to Norway as well. So if this is of interest, so this could be discussed. If delegation from AIIMS Delhi wants to visit to Norway, so this could be also one potential to be discussed bilaterally after this meeting. So we can follow up the ongoing MOUs and R&D projects. We can explore new business and collaboration opportunities. Of course, as I mentioned previously, in student and staff and researcher mobility is also important part for us. And academia and industry collaboration, internship, where students comes to India, or Norwegian Indian students go to Norway, for example. So they bring a kind of a week to month in industry to learn something more about innovation. And of course, sharing knowledge and organizing events like meeting and seminar and webinar together. That is also important for us, and we facilitate platform for that. On 25th of May, so we are organizing one webinar together with PGI Chandigarh as well as AIIMS Guwahati. One webinar on ethics of artificial intelligence in the health sector. So that will be organized on 25th of May. So this is like example, and if you have any idea, if you have any kind of suggestions, or if you have any kind of comments, so feel free to contact us, and we will be happy to facilitate or provide information and guidance according to the relevance. So I welcome you all to visit beautiful country Norway. Very beautiful, very peaceful, very nice. If you haven't been there, so please do visit us as a profession or as as a tourist, whatever. So and explore more collaboration with our country. Having said that, so I would like to thank you all, and once again, congratulations for this beautiful International Nursing Day today, and wish you all the best. Thank you.
Thank you, Dr. Mansingh Sidhu, for a warm and welcoming invitation to your country, uh, for our students and for the staff. And thank you for letting us know about the different collaboration opportunities. Thank you for letting us know about the different collaboration opportunities for student and the staff as well, and letting us know about the different panoramic program. And it is interesting to know that we are one of the 9 countries with whom Norway has collaborated. And it's also very interesting to know that in June there is a visit faculty members for collaboration and maybe mutual interest or some funding opportunities. Yeah. Yes, yes. So thanks, Dr. Sidhu, for detailed explanation about the different collaboration and funding opportunities for us. And we will look into forward for this. And with that, we'll break here for tea, and maybe we'll come back after that. And with that, I would also like to welcome Mr. Mirza Shadan, who is with us, who is a senior manager, Global Health Strategies, Delhi. So welcome, Mr. Mirza.
Thank you.
And we'll proceed for the tea.
ये आदमी डम है थोड़ा सा ना।
और ये हमारे साथ ऐसा क्यों हुए जा रहा है? मिस्टर सुजन कहाँ है?
उन्हें वो है नहीं ना, ये आदमी को समझ ही नहीं आता।
अभी म्यूट है ना?
अब तो म्यूट कर दिया मैंने। अब इसका कैमरा इधर का चल रही है, समझ आ। अरे चलो ना, चाय चू ले लो जो लेना। ये तो बंद कर दिया मैंने। नहीं नहीं, बाकी को बोलना, यहाँ भीड़ के लिए बोलना।
क्या
इनको बोलना,
क्या बोलना?
जा नहीं रहे ना बाहर। वो कैमरा है ना, उससे 1 मिनट रुकना। उधर देखो, बराबर आ रहा है। इधर आ रहा है, पूरा आ रहा है। ये आप ठीक है, पहले तो इतना ही आ रहा था, वहां खड़े होकर कब आ जाए पहले तो इसी तरह
आप सेट से हैं?
नहीं, ये करेंगे आप, अब तो हो गया। नथिंग नहीं
नहीं, पर जब अब आगे भी लेक्चर सेशंस होंगे तो
ये नहीं करेंगे ना, कमल करेंगे ना। हाँ, कमल करेंगे।
इको का इशू आ रहा था एक्चुअली हमारे पिछले सेशंस में।
टेक्नीशियन को बोल रहा था, वो तो सूजन या कमल ही करते हैं, बाकी नहीं करते। कमल को बोलो। नहीं, कमल तो इधर आएंगे। So they will do. They will. लैब है ना, ये लैब। एक ऑफिस स्नैक्स लीजिए ना आओ। आज ही लोगे तो कब लोगे? चलिए एक फोटो मैं खींच लूंगा मेरे पास बड़ा कैमरा है। कब? ये साइड पे है।
इनवाइट के सबको चाय के लिए तुम भी इंक्लूडेड हो गए।
चलो। हाँ, कह रहे कि आप पे कुछ प्रॉब्लम है। इको ऐसा कुछ क्या कुछ बोल रहा था।
यहाँ पे सर
इको इशू है ऐसा कुछ।
कमल थे, कमल भाई सर।
हाँ, कमल को बोलो। कमल कहाँ?
अभी डॉक्टर के दीपक का
And items. तो
सर ये लैपटॉप से भी ज्वाइन किया हुआ तो सर यहाँ से बोलिए कि सर जीरो करनी होती है, क्रॉस करनी होती है। कौन सा
हाँ, ये क्रॉस है। हेलो लिख भैया, आ रहा हूँ आ रहा हूँ।
इतना तो बहुत है ना सर लाइव।
लाइट तो ठीक है सर, बट ये इको का प्रॉब्लम आ रहा है ना।
किसी का मैम वो खुला होगा ना।
नहीं ना भैया, उस टाइम सबसे पूछ लिया था, ये बड़ा इशू हुआ। मुझे लगा था सब फैसिलिटी में ये प्रॉब्लम नहीं होती, बट यहाँ पे भी।
हेलो,
एडमिट करना पड़ेगा। मैं कैसे नहीं कर पा रहा सिंगापुर से कोई।
हेलो, डू यू हैव CMAC blade with you? That's what I'm asking. Do you have CMAC blade with you? CMAC. Yeah, laryngoscope. So I need a D blade. Yeah, only D blade. Okay, provide me. ठीक है. Okay. Bring it today. That's fine.
We will welcome you back after the break. For the next session, we have Dr. Shana Akers, the Dean and Professor from Liberty University School of Nursing, the USA. Ma'am is going to talk on the topic Invest in Nursing, Change the World. We are very privileged to have her today amongst us. She'll be delivering her lecture online. I hand over the mic to Dr. Shana Akers. Over to you, ma'am. Ma'am, are you there online?
See whether the message is that it is recorded. It is recorded.
Recorded?
It is already share screen and open it. आपने open करो ना.
रिकॉर्डेड है
हाँ recorded है.
मैसेज रिप्लेस का ये मैडम तार मत हिलाओ, ये भी चला जाएगा दोनों जगह से.
नहीं डायरेक्ट
लैंड लाइटिंग तो
नहीं चला ये वाला
ये ये
हाँ,
ये तो स्लाइड है. ये है ना कि
पार्टिसिपेंट्स का कौन कौन है नहीं
हाँ हाँ ये है लिंक खोलो इसको ना ऑनलाइन आएगा.
हाँ
सेकंड
ऐसे इसको राइट क्लिक करो, एक मिनट
कॉपी कर लो ना.
कॉपी का
नहीं
जरूरत
नहीं
है
कॉपी
ना,
करना
ये
है
ना, ये
ओपन लिंक
डायरेक्ट करते हैं बस आ जाएगा. डायरेक्ट ही चलेगा. ठीक है एक सेकंड.
आप स्क्रीन शेयर कर दो.
अभी शेयर चलाने में तो जब मैं बोलूँगा
रिटायर कर लो इसको.
एंटायर नहीं आएगा. ये
ये
हमें कौन सा स्विच करना है. मेरे साथ ही रहो, इसको चलाओ आप. ये यहाँ से प्ले कर दो बीच से. चलिए
Again, you will play.
Celebrate International Nurses Day on the founder of nurses' birthday. That will impact
नहीं स्क्रीन विल बी शेयर स्क्रीन शेयरिंग कर दो.
एक बार है ना रिटायर कर दो.
Good morning. First of all, I would like to say thank you to Dr. Latha and the All India Institute of Medical Sciences College of Nursing for allowing me the opportunity to share a little bit with you today. My topic is Invest in Nursing, Change the World. And as we celebrate International Nurses Day on the founder of nurses' birthday, Florence Nightingale, we have a lot to be thankful for, a lot to be grateful for, and a lot to see that's coming that will impact who we are as nurses and all that we're able to accomplish for our communities. So let's talk a little bit about Florence Nightingale, and maybe we can understand the history of nursing and how it leads into the practice that we have today. First of all, Florence Nightingale was the founder of modern nursing. She was the first nursing researcher having studied hand washing and the impact of a clean environment. She discovered that the cleaner the environment, the cleaner practitioners' hands were when they care for patients, the better patient outcomes. And this was long before germ theory. She opened the first nursing school in England, and she wrote over 150 books, pamphlets, and reports, all related to nursing and healthcare. She was an amazing statistician. One of my favorite quotes from her, nursing is an art. And if it is to be made in an art, it requires exclusive devotion as hard a preparation as any painter or sculptor's work. For what is the having to do with the dead canvas or dead marble compared with having to do with the living body, the temple of God's Spirit? It is one of the fine arts. I had almost said the finest of fine arts. And through her leadership, nursing has evolved from bedroom practices and quick conversations in the hallway to what we see today. Her leading and her guidance, her investment in nursing has truly changed the world for better. The World Health Organization defines nursing as encompassing autonomous and collaborative care of individuals of all ages, families, groups, and communities, sick or well in all settings. It includes the promotion of health, prevention of illness, and the care of the ill, disabled, or dying people. And the WHO recommends that we have 3 nurses for every 1,000 people in our population. So interestingly, I did a little bit of research on the number of nurses in the world. We have almost 28 million nurses in the entire world. And of those nurses, 9 out of every 10 of them are female. But we still have a shortage of nurses, somewhere in the neighborhood of 5.9 million. The need for nurses is huge. Our goal for what we need to do to impact communities and change the world, we have a lot to do to get to that point. 80% of the shortages are in low and middle income countries. And that's a true challenge for individuals who have no access to nursing education. When I looked into the United States, we have just under 3 million nurses, RNs across the United States, 2.98 million to be exact. That's 11.7 nurses for every 1,000 persons. And still we have a need of between 300 and 500,000 nurses are needed within the next few years. In India, did you know there are 1.4 million nurses? When you combine nurses and midwives, it comes out to 2.34 million. That's 1.8 nurses for every 1,000 persons. But if you look to those that have qualified education and competency-based nursing education, it comes out to 0.6. India is in need of more than 4.3 million nurses by the year of 2024. I would say we've got our work cut out for us all around the world. We need more nurses to support the goals of nursing. The country with the most nurses is Finland per capita and Norway in sheer number. However, those that with the least nurses is Turkey, Chile, and Mexico by capita, and Somalia in number. The largest producer of international nurses is the Philippines. And I think we see this as an example of we need nurses everywhere. Every country has a need for nurses, and we should be engaging in promotion of nursing as a profession for individuals who love to help and serve and who are interested in research and science. So how do we invest in nursing? Because we know that it's a need for healthier nations. We need this. We can advocate for our profession and for our patient. We advocate through education. We tell individuals what we do as a nurse. Many times when someone says, what do you do for a living? What job do you have? We might reply, I'm just a nurse. Instead, I would challenge you to educate individuals on what you do. For example, I am a nurse. I've been a registered nurse for 26 years. Currently, I teach in higher education and train the next generation of nurses in both bachelor's, master's, and doctoral programs. Before I became an educator, I spent 13 years caring for individuals in a cardiac ICU, caring for those most in need in my community, and educating the community on medical illnesses related to the cardiac system. So that included congestive heart failure, cardiac death syndrome, and many, many more. When we take the time to truly explain who we are and what we do, the public, as well as our leaders, our local, state, national leaders, better understand who we are as nurses and why there is such a need for us in our profession. We also have the ability to serve our public and volunteer as a nurse. Have you ever considered working with your spiritual group and educating them on a disease process that you see as rampant in your community? I've worked with nurses who have taught classes on blood pressure or diabetes to their church to improve the opportunities for those individuals to learn about potential health problems, as well as ways to mitigate those problems and potentially reverse them. It's a chance for us to talk about healthy lifestyle, work environment, and how all of these things impact us, how on our bodies, and how we can make best choices. I remember one time, one of the nurses I worked with was educating on diet and the need to eat healthy green food and why we need fresh fruits and vegetables in our diet. And one of the ladies came up to her following and she goes, I can't afford it. And honestly, the grocery store that I walk to does not have fresh fruits and vegetables. If they had them, I couldn't afford them. So there began that partnership between nurse and patient and community. And that partnership allowed the nurse to educate on different options of what could be chosen, looking at different types of food that this person could introduce into their diet for healthier living. And goodness knows, we all need a little more health in our life. We also can encourage the next generation of nurses. Many times I speak with high school students. My daughters are in high school, and so I have a chance to talk to their friends about the benefits of nursing here in the United States and globally. I get a chance to share with them the passion that I have for nursing, and I would challenge that you can do the same. Whether you're a student or a faculty member watching this, or perhaps someone who might be interested in nursing, we have the opportunity to share our passion. Why did you become a nurse, and why do you continue to practice as a nurse? Why did you become a nurse educator? What was that dream and vision that you had? The more that we are tied to our vision and our ideals and the why behind what we do, the more passionate we are. I became a nurse because I truly believed that I could make a difference in individuals' lives and in the community. I could take an opportunity to take care of someone in the most vulnerable moment in my ICU as they were potentially facing death or the death of a loved one. And I could make an impact, whether that's with praying with them, ministering to them, ensuring that they have their basic comfort needs met, as well as ensuring that they have evidence-based practice caring for them, that I am applying the science of my profession to that bedside care. Now, as an educator, I have an opportunity to teach undergraduate students the passion that I have for nursing. I teach our PhD students and talk about educational leadership and why it is so important for the next generation to be available. We also, as nurses, have the ability to find creative solutions. Nurses are some of the most creative people I have ever met. We're entrepreneurs and business people as much as we are caregivers and individuals who love people. We have challenges in staffing. We already stated that we do not have enough nurses in the world to care for the world's population. Both in your country and mine, we are challenged with having enough nurses to care for our populations and our communities in acute care and in chronic care. This challenge allows us to be creative and to find ways, new staffing patterns, new nursing practice models to improve patient care, even though we have limited resources. And nothing is more true than in the last couple of years through the pandemic that we have truly seen nurses be creative in finding solutions, being there and using technology and leveraging it to improve patient care and outcomes. We also can find solutions to things like incivility and workplace violence. We have opportunities to make these impacts through our attitude and the culture that we demand and the expectations that we have for each other and for ourselves. It's up to us to create the culture of nursing that we want, a culture of nursing that is inclusive, a culture of nursing that is engaging and investing in one another, as if we were family, because I think truly when we do trust each other, when we do understand, we connect and communicate better, and that connection and communication improve patient care outcomes. we also have the ability to promote our profession. I tell people all the time, whenever I leave here, people here know I'm a nurse. But if I was in scrubs in a uniform from the hospital, I would be at the grocery store picking up my dinner, and perhaps someone might ask me, "Are you a nurse?" I am a nurse no matter where I go. I am a nurse just as much as I am a mother and a wife. I am a nurse just as much as I am a Christian and a believer in the Lord. As a nurse, I have the capacity to be a role model, a healthy role model, preferably for my colleagues and peers within the community. It's my goal that I am promoting our profession, that I walk with an attitude of professionalism no matter where I am and what I do, because everyone has somebody watching them, whether it's a young student, whether it's a professor, whether it's someone in the public. We have that responsibility to promote our nursing profession. We also need to be mentors, mentoring those that are coming below us, mentoring peers in different skill sets. It goes back to learning. Nursing is a constant practice. And if you are excellent at understanding research and you understand the quantitative data, maybe you should be mentoring other individuals who want to learn that from you. Maybe you should be guiding them in the next steps of research. If you're a qualitative researcher and you're interested in getting into the depths and the perceptions of a situation, you have the opportunity to discuss phenomenology with all of your peers and getting them engaged in that research. Maybe you're great at mentoring, building relationships. Maybe you should be role modeling that and making points to those individuals who could grow in that area. We should be engaging each other, encouraging one another, and learning from one another, because someone is always watching. Another thing that we can do is promote research and evidence-based practice. Nursing for decades was seen as a caregiver. We were seen as someone who passed medications and comforted individuals. We were seen as someone who followed orders and did what we were told. And in some cases, that is still true. However, the practice of nursing is becoming more and more autonomous, and we have guidelines by which we practice, and those are evidence-based. They should be evidence-based. We can no longer say, I do this because it's always been done. We must say, I do this because the literature shows that is the best practice in the care of this disease process, that this change in practice has improved patient care and outcomes. It's improved the patient experience. It's improved nursing practice. This is where we should do this at, because it does improve patient care outcomes. When we know that getting individuals out of bed and walking them sooner following an acute MI actually improves their health and their strength and their status. We also know that it improves organizational outcomes. So we all work for an organization. We work for either healthcare or education, and we need positive outcomes for those businesses. We need that because we have to sustain healthcare. And to sustain healthcare, we have to always be looking for the next thing to make an improvement in resource management. And I think nurses own that responsibility. We are the largest workforce of healthcare providers in any nation and across the world. And there are many things that we can do to improve healthcare for the organizational level. We can improve financial standing of the organization by decreasing waste. If we don't need multiple products, but one would do it, we should consider transitioning into using one product to take the place of many to decrease waste. We also know that research and evidence-based practice improves education. And as an educator, I tell my team and my colleagues here all the time, we need to be practicing evidence-based education. So as we teach, we need to be doing it leveraging technology, using the literature to support our actions, whether it is flipping a classroom, whether it is engaging in a new style of teaching, whether it is looking and reviewing our course objectives or our program outcomes, looking at these opportunities to improve evidence-based education. These are all the things that we can be doing, and I'm quite certain that you can come up with many, many more. But why is this important? Why is it so important for us to invest in nursing? And here's how we change the world. Because you see, relationships and building relationships is part of who we are as nurses. It gives us the opportunity to create connections with patients and with families. When we have a relationship with a patient and or their family, we build trust. And in that trust, we're able to pull out small pieces of information that are very important that the patient may not have understood was important. One example of this, I was teaching a patient one time, a client, about congestive heart failure. And this individual had had congestive heart failure for over a decade, but had been repeatedly in the hospital a lot over the last year. And I wanted to say like 6 times she had had an exacerbation and was in our ICU or in our cardiac floor. And I met with her to have some conversation on what she's doing. And in discovering and in just conversing with her, she had a misunderstanding of her fluid restriction. She thought she was supposed to drink 1,000 milliliters of fluid a day of just water, in addition to her coffee, her hot tea, her soda, other things that she was drinking, when in reality, she was only supposed to drink 1 liter of fluid for the entire day. When I could understand where she was coming from, just through a few simple conversation and questions, we were able to find a solution. And when she better understood what she needed to do in her care plan treatment, all of a sudden she quit coming to the hospital. We were able to check in on her and she's been doing fine. It's a simple moment of education built upon trust that truly impacts. 86% of the time a patient spends in the ICU is with a nurse. As nurses, we are with patients and families more than any other healthcare provider. And it's because of that relationship that we build with them creates trust and opportunities to correct misconceptions, as in my example, or to educate and to give truth so that we can see new changes and better outcomes for our patients and their families. We serve as patient advocates. And as a nurse, we know that we advocate through the coordination of care, whether it is the transition of a patient from an acute care hospital back to home, and we're providing education to family members so that they can provide care for their patient and their family member who's been in the hospital. We also can work as advocates and working with policy and legislation and have a positive impact of the healthcare of our state, our nation. It gives us the opportunity to speak with legislative leaders and create an opportunity for change. It gives us the chance to educate them on the role of nursing to advocate for our patients and for best outcomes and practices. We also prevent errors. As nurses, we know that we are the last line of defense for our patients. And many times it's the nurse who catches a mistake, whether it is the double ordering of a medication that's the same medication, but maybe same class of medication, but different name of medication. Maybe it's the realization of giving someone too much fluids because they're going to go into failure. Maybe it's the acknowledgement of the fact that they need physical therapy so that they can progress to their new level of health and wellness. These are all things that we do as nurses. Education is also what we have to do, and why is it important? We are the ones who educate on treatments, medications, and diseases as much as on health and wellness. I think nursing in the future is looking more towards a health and wellness model. How can we prevent individuals from being sick? How can we prevent an illness or a disease within a population? And we do that in a lot of different ways through education of individuals and within communities. We also have the opportunity to do holistic care, which I find absolutely fascinating. Holistic care is looking at the individual as a whole being, the physical, the mental, and the spiritual elements of this person, and how we can impact all three of them. I may be caring for a patient and giving medications to help with the physical. I may be counseling with them in a way to help with their mental and emotional challenges following the disease process. But I'm also there to help guide them in a spiritual moment when they need uplifting. I may not always agree with the spiritual elements of my patient, but I'm there as a resource to provide that care for them. That's part of our role. Our nursing diagnoses across the world offer spiritual distress as a nursing care diagnosis, impaired spirituality. These are things that we can take as nurses and make an impact on, whether we have resources that we pull in or whether we ourselves share a common faith. We can also help to create a healthier nation. Through a healthier nation, through awareness of important health issues, I would bet if I was to ask any one of you, all of you would be able to name an issue that's facing the health of your country or of your local community. Whether it is COVID-19, and we've understood that that has been a challenge worldwide, whether it is heart disease, whether it is strokes and neurological diseases, whether it's genetic abnormalities, these are all things that we can educate on and help to create an awareness among our communities to improve healthcare. It's also been noted that vaccination rates of communities with higher nursing populations are up. So basically, the more nurses we have, the more vaccinated individuals, and we can help to eradicate some of these disease processes because nurses are willing to go into communities and help vaccinate individuals. We also know that nurses have an impact on the social determinants of care. Social determinants of care are those elements that impact someone's ability to access healthcare, someone's ability to understand and their literacy of healthcare, the ability for them to grow and change through healthcare. And nurses own a huge piece of this population, of this element. And so my challenge to you is we have a huge need in nursing. We need investment in nursing from each one of you, whether you're a student now, whether you're about to graduate and be in the workforce of nursing, whether you're a faculty member, whether you're a policy maker. We need more nurses to advocate, more nurses to educate, and more nurses to make a positive impact on healthcare, because it is only through nursing and the investment in nursing that we'll be able to change the world for the better. So invest in nursing and change the world, one patient at a time, one family at a time, one community, and all of those will add up to one nation. And when every nation has health and wellness embedded in their core of who they are and in their culture, the world will change. And as Florence Nightingale said, how very little can be done under the spirit of fear. So be courageous, walk through the open door, and invest in nursing.
Our heartfelt thanks to Dr. Akers in absentia. We can see that she is truly passionate about what she does as a nurse, and she has highlighted on why we need to invest in nursing and the multifaceted role of nurses in the healthcare setup, as well as in the education and in research also. And she has focused on the building of relationship with the patient and how we can be a safety net for the patients. I really liked how she has put it, to change the world, one patient, one family, one community at a time, and the whole world will be changed. All of us agree to that? Yes. So our heartfelt thanks from the College of Nursing again to Dr. Akers. I hand over to Mamta for the next session.
Thank you so much, ma'am. Now I invite Mr. Mirza Sadan, Senior Manager, Global Health Strategies, Delhi, to deliver a talk on Global Health Strategies, Use of Advocacy, Communication and Policy Analysis. We welcome you, sir.
A very good afternoon to all of you. It's a privilege to be speaking at the College of Nursing in AIIMS. I've only heard of this milestone, great institution, but now I'm here. So it's a privilege to be meeting all of the people here, especially the young student at the back. I hope to make some impact with my talk today, but that's a big hope. So I do think there should be. Yeah, I'm a very big optimist in that regard. So I'll start off with my basic life, like, what nursing was for me and what global health was for me. So when I started out as a young kid, I only knew health because my aunt was a nurse. And she was the one whom my mother consulted every now and then for every little problem. So if I was sick or if my sister was sick, she would call up my aunt and say, "Oh, he's sick. Should I go to the doctor? What should I do?" And even for taking very knowledgeable advice, like, for cervical cancer vaccine, the first person my mother consulted was a nurse and not a doctor. And I realized after some time that that has been the practice for years for women across the families in India. And I do not speak for everyone, but mostly, that nurses play such a critical role in our families. And as Miss Atkers also mentioned, that one family, one community, and which multiplies into one nation at a time. So it was a privilege getting to having a nurse in the family. And it was an honor, like, to talk to her, to listen to her stories about how she would do patient care. But then moved to Delhi. I came into the world of global health, public health, the big names, the big people, the ICMR and the AIIMS and, the Ministry of Health and Family Welfare and WHOs. But there was one name missing, the nursing world. What we were doing was we were consulting with everybody in the room, but not nursing. In my very short career, I've attended more than 30 conferences, 30 public health meetings, hackathons for, like, developing healthcare solutions where there were engineers, where there were public health administrators, but there were no nurses. The point of care for every patient has been nurses. And as ma'am also mentioned, and I'll go back to her talk because I was very inspired, that 79% or 80% almost, the time spent by a patient in an ICU is with a nurse. So why are we not including them in the highest level of conversations? Why is there a gap in having nurses and having them getting a seat at the table? I'll get one more example and then I'll stop talking because I have a habit of going on, and then we'll move on to this presentation. In COVID-19, nurses, doctors, and all healthcare workers were the heroes of this whole scenario. Nurses contributed, if not more, but equivalent to a lot of other peers. But in all the images that I saw, because I work heavily with the media and journalists, there was another missing element. Nurses were not present. Nurses were not the poster child. Nurses were not given enough, so to say, coverage or attention in those spaces. So why is that the case? Why we still as a nation continue to fail nurses, and at that point fail our healthcare systems? Because if, like, the primary caregivers are not present in a room, we cannot have solutions or effective healthcare without them, right? I think we all agree to that. And we all agree that investing in nursing, and that is the topic and the theme for the event, that it is not only important for the nursing field, but for global health, but for public health, and for efficient care, and for the community, and for the nation. So the topic of my presentation is putting nursing on the global health map, putting nursing where it really belongs. So I am not doing you guys a favor here. You guys really have been doing your jobs really well, but we have failed as a public health community to acknowledge the efforts of nurses and the field of nursing in the global health landscape. So I'll move on. I want to first give a brief overview of global health strategies, what we do, because of course my office has paid for this visit, so have to do this. So Global Health Strategies is a communications advocacy policy firm headquartered at New York. What we basically do, in very simple, plain terms, I will not reuse the corporate jargon. What we do is we take up an issue, we get everybody excited in the room for it. So be it national level leaders, champions, politicians, media, civil society, doctors. So for instance, if we took up an issue of tuberculosis, the increasing deaths in tuberculosis in India, and it is, I think everybody is aware of how big tuberculosis is a problem. So what we do is we basically engage everybody in the world to talk about the issue, and that leads the government to take action on the issue. They prioritize the issue, and then we see an outcome. And this is basically what we do. There are a lot of jargons in this slide, so I will not go to it. So I basically work at the New Delhi office. There are a bunch of other offices across the globe of our organization. I want to play this small video. I don't know if can we play this? Okay, no worries. So this is a video of a very popular champion. I don't know if all of you have heard about Game of Thrones. If not, like watched it. So this is a very popular actress talking about the import, and I'm talking to the people at the behind. I'm usually at the behind on all of these talks. So I'm sure you must have seen like Game of Thrones, heard about it, and this is Amelia Clark talking about the importance of nursing, of the importance of investing in nursing as an issue, of the importance of having nurses at the leadership table in public health. And she gave like and she's a good brand ambassador for nursing globally. But why did she post these messages? What is at stake for her? Why don't we have like the Amitabh Bachchans and the Indian diaspora talking about the relevance of nursing, the relevance of and importance of nursing? Why don't we see national level articles by like nursing leaders on some of the issues that we have? So I'll go back. The simple answer to this question that I posed right now is sustained advocacy. I know what you understand from advocacy is basically being a patient advocate, but I do not feel that nurses need to do more around patient advocacy. You guys have done a brilliant job in ensuring that every person or every family is taken care of. You are a great patient advocate, and I do not think I am the right person to tell you how to do that more nicely. But I can tell you one thing or two that I have learned in my short career about advocacy. What you really need to do to get through that room. So, what really is advocacy? I'll again simplify my slide. It is to use evidence to create a change at the policy level and create an impact that affects a large population. So, communities, nations, conversations, so on. So, why do nurses need to do advocacy? What is even the point? Like, why would, Dr. Cecilia, why would you do advocacy? There's no point. Like, you have to come and do your job. That's about it. But I think the conversation today is basically to raise the profile and status of nurses and midwives globally and at the national level, increase investments in nursing trainings and employment, empower and promote leadership for nurses both in private and public healthcare systems. So nurses should not only be at the seat at the table in the public healthcare systems, but should also be at the seat at the table in the hospitals where you work. You are the people who know patient healthcare better than everybody. So you should be making those decisions or be at the table where these decisions are making for nurses. I was seeing this TEDx talk by a nurse who said that, I was the hospital introduced a mechanism of better communications for the whole hospital administration, and nurses found it very difficult to cope up with the system because it increased their workload rather than decreasing it. So basically it was not at par and not useful for the nurses. So she asked, why is that happening, and why are we consulted after an intervention has been introduced? It should be before the intervention is introduced, so that everybody takes a decision together and it is an efficient system. So that is what advocacy is at large. That you get a seat at the table, you create an impact, and you make decisions. Please feel free to ask questions. I use a lot of jargons, sorry. So please feel free to ask any questions. So I present a case study of somewhere in London and New York that we supported an initiative called Nursing Now. So basically, Nursing Now is an initiative. I am sure some of you are aware of it. They take the young leaders from the nursing space and make them as champions of nursing. And as advocates, they do a lot of trainings for the nurses, the young junior graduates. So what did we do? So because we really didn't want the nursing sphere knows what nursing is doing, we really need to advocate to other people. So what we did was we reached out to a lot of our stakeholders, a lot of our health stakeholders. We got everybody excited about this initiative. We got Dr. Sania Nishtar. I don't know if a lot of you know her. She's WHO DDG, and she is a very well renowned public health expert from Pakistan. We got her to write an opinion editorial called Nurses Are Silent Heroes in an international daily with a nurse, of course. And, that got a lot of traction. Then we, of course, got Dr. Tedros, who is the head of WHO, to talk about this initiative, to talk about the need for it on his social media platform. And that created a rage in the international community. That created a momentum that was never seen before in nursing. So this is with just like these small steps that some people took that was so advantageous that got nurses a seat at the table at WHO as well. So that was the start of an era where nurses were not really seen as a sort of a subordinate or but were seen as partners in healthcare delivery. And that is what our aim is really. I'll now move to something that GHS does in India. And I'll take an example of lymphatic filariasis or elephantitis as it's known, or hati pau in Hindi, which is known. So what did we do? This is such a boring issue. Who wants to talk about LF? You talk to your family about LF, they don't care. So how do we make this issue more exciting? We, of course, reached out to our technical stakeholders and got them to write a lot of media pieces, got them to interview. But we also realized somebody needs to champion this cause. Somebody who you listen to. I mean, I would listen to Alia Bhatt, for sure. Do I listen to Dr. Randeep Kuleria's talk? Maybe because I'm in public health, but usually not. So if Alia Bhatt and Ranbir Kapoor were saying something that, LF is a priority issue for us, I would listen to them. So that is where really it captures the essence of getting people excited for an issue. And then we, of course, Swapnil Joshi, he's a big celebrity in Maharashtra. We got him to talk about lymphatic filariasis because that's a big issue in Maharashtra. We, of course, understand that, a lot of people don't understand that we continue to talk in English to our stakeholders and continue to use social media in English for our stakeholders and write these English opinion articles and media dailies, and do not really understand that the stakeholders which we are influencing are Hindi speaking stakeholders. Or I'm not even concentrating on Hindi, Malayalam speaking, Tamil speaking. So we got all these social media collaterals that we were making for LF. We got them in local languages so that the people that we are trying to target are influenced by these. So what do we do? I'm not going to go through my presentation. What do we do? How do we solve this issue of getting nurses a seat at the table, more investments, prioritizing it in the national agenda? I think it starts from an individual level. I think it starts with more participation of nurses in conversation at the hospital level, more participation of nurses as innovators, entrepreneurs, more. I think there has to be a lot of motivation and mentorship by senior leadership that, the young nurses should not only think about going to their jobs 9 to 6, but also creating an impact, but also getting into conversations where these decisions are making. So we all have to take a more proactive approach, and this is not all on you. From now on, I also become a nursing advocate. So from now on, when I go to a public health conference, the first question I ask is, where are the primary caregivers? Where are the primary people who deal with patient care in this conversation? So that is how all of this will work. I think it should, your advocacy objective, or for College of Nursing, for instance, what do we do? I came here, I talked about global health, left no impact. This was a great talk. It was funny for a bit, but we go on about our daily lives. What do we do? I think what we need to do is talk more in the media, talk more to our stakeholders, talk more about what are the issues even pertaining to nursing. What do we need? Because I'm not going to tell you what nurses need. You are going to tell me what nurses will need, and bring your problems at the forefront. And also with that, of course, bring your solution at the forefront. Get a social media page where you proactively talk about what is happening in your institute. This talk, this talk should be on the social media page of your college or your institution. Even at a personal level, I see so many foreign nurses being so active on social media, raising issues. USA does an excellent job of it. They have a whole network of nursing advocates. They make sure their voices are heard at every level ever, and they criticize when it is not heard. So maybe that is an approach that we need to. I'm not saying criticize anybody. Please do not hold me accountable for it. But I'm saying, like, you have to voice your opinion in a more public forum and not really talk mostly in, like, nursing colleges. You have to move beyond, because that is where the decisions are being made. Mapping your stakeholders, it's really relevant, like, to know who you're talking to. So for today, if, like, we decided that, we need more nursing colleges, if we decided we need more nursing students, we need to really target those people. So if we needed more nursing college students, or we need to have the cream of students in nursing colleges, because that is also an issue. We need to target schools, CBSC, NCRT, and all of those are our stakeholders. Ministry of Education, tell them that, there's a great gap in nursing, in registered nurses, and talk to them about solutions and collaborations. And sir mentioned collaboration a lot of time, because it is through collaboration and partnerships that we all move to the next stage. So that is what is important and pertinent to the issue of nursing right now. Developing your messages, I think that's very relevant for anybody. I'll give you an example of, like, how we need to simplify, and this is mostly for global health people, that we need to simplify our messages, simplify our messaging when we are talking to our stakeholders. When you're talking about nursing technologies, nursing innovation, need of nurses, please simplify what you're telling to your stakeholders so that they also understand. I'll read out an example for you, and this is based on a newspaper, the interview that a technical expert gave. So the technical expert said, but vaccine coverage must be improved, and lower cost vaccines are needed where the burden of pneumonia is highest, particularly in countries like India and Nigeria. What a boring statement to make. Nobody's going to, if you read the newspaper, this is not a statement you want to read. And you don't even understand, like, who reads this? So a more simplified version of this would be, but we need to reach more children with vaccines, and more affordable vaccines are needed. Whether most children suffer from pneumonia, particularly in countries like India and Nigeria. So you make these small changes in your approach, and that message really reaches the audience. Giving a call to action. So I put out, like, I saw, like, some social media creatives that, they were putting out. I heard that, nurses were the last people to receive, like, the COVID care equipments in many countries. Like, those are the challenges that we really need to talk about, that we really need to advocate for. And, there are a lot of movements that we can put our weight behind. So that's about it. I think that's as simple as that. I will not bore you with any more advocacy strategies, but this is what really is. And, to talk about, like, being a health advocate, I think nurses should not only say I am a nurse, but also say I am a health advocate, because you are the ones who are advocating for health at the personal, family, community, and the national level. I end my talk here. Thank you so much. I hope it was okay. Thank you.
Thank you so much, Mr. Mirza Shadan, for highlighting the need to invest in nursing profession, the need to put nursing on global health map and bring nursing onto leadership tables through advocacy, mapping the stakeholders and making voices of nurses heard at public forum, and most important, giving a call to action. Thank you so much, sir. Now I welcome Ms. Meeravati PS, educator, NTUC Health Singapore, to deliver a talk on challenges faced during COVID perspective from Singapore. Welcome you, ma'am.
कल लेक्चर है क्या रिकॉर्डेड है लेक्चर है रिकॉर्डेड ही कह रहे हैं सर ऐसा नहीं आएगा सर
Directly. No, she's also joined. She has given recording. Just play the recording. Play the recording.
कुर्सी वाली ये वाली एक सेकंड रुक तो जाओ सर आप मुझे भी
Ms. Mirawati, and thank you so much for nursing the world, especially India, to help. Really appreciate what you all are doing. Now, today I'm going to talk about Singapore's perspective, the challenges we face during the COVID. Right, my full name is Mirawati Purushotman. I'm a nurse educator in Singapore, and I want to talk to you about the challenges we really faced during the COVID period. I'm sure you also will be having a lot of challenges, but let me share what we were doing on our side. Now, I come from a healthcare organization. There's a very large healthcare organization, and it's industry recognized. Okay, our services have earned the recognition of awards such as Asia Pacific Elder Care Innovation Award. We have a Singapore Health Quality Service Award, and then we also have Excellence Award from the Community Care, and we also have some awards. We call it because Singapore is very small, we don't have much gardens, you see, though we have some landscapes and all that. But in the nursing home itself, we don't have much space because they're all built upwards. So what we have is we have a high-rise garden. Okay, so we started this project on high-rise garden and together with the national park. So they awarded some awards as well. And we also have this community bloom where we plant a lot of flowering plants so that we can actually make the environment more lively, right? So, and also, if you look at NQC Health, where I come from, we support the elder care institutions and we support with all the essential care services island-wide. We have about 24 daycare centers and 5 nursing homes, and also we have about 20 rehab centers. So it's very, very huge, very large organization. Okay, right. Now, let's look at how Singapore managed this COVID pandemic. Okay, right. Something a little bit about Singapore. Maybe some of you have not come to Singapore, so I thought maybe I just share this slide with you. We are much smaller than Bangalore because the size of 728.6 square kilometers. So, and we're much smaller. We don't have any natural resources. We don't have cows. We don't have paddy fields. We don't have anything except for all our beautiful green sceneries we have. Right? So we heavily rely on tourism, especially medical tourism. So in the year 2019, right, we used to have about 19.12 million international visitors coming to Singapore. All right. In the year 2020, we really dropped drastically to 2.74 million visitors. Singapore is thriving on tourism, remember that, yeah? Because tourism will generate employment for our people in Singapore. We also have foreign domestic workers. We also have foreigners coming in. So we create jobs for them. Could be in the sales, could be in the hotel. And this also boosts our foreign exchanges also. All right. And of course, we have travel and transport as well. If you look at Singapore, the tourism industry, we have major international flights. Okay, we call ourselves a major international flight hub. Flies many countries, all right? Changi International Airport, we got one flight every 80 seconds, taking off and on or arriving. We have, when COVID came about, we make sure that we had strict surveillance. We did our temperature taking, we did swabbing and quarantine orders, right? So, and if you look at, we had several cases actually through the screening exercises. We had cases from UK to South Korea. So Singapore became very uniquely challenged because we need the tourism. We had a lot of infections coming in from our international partners. Right. How it all started. Okay, I think this one you all know lah. It all started on the 31st of December 2019. China informed WHO about this novel viral pneumonia in the city of Wuhan in Hubei province. Singapore is so far away, 2125 miles from Wuhan. And we take a lot of China visitors, about 330,000 visitors from China every month. Okay, so, and a month later, we started doing, Singapore authorities started doing this temperature taking screening at the airport and identify any patient with pneumonia and recent travel to Wuhan. Then the first case, COVID positive, was from Wuhan on the 23rd of January 2020. And then globally, it started spreading everywhere. As of, this is the global one. As of 29th of April, the latest data, if you look at it, we had about 510 million confirmed cases of COVID, including 6 million of deaths. Right? And then they started vaccination as of 26th of April. A total of 11 million vaccine doses have been administered. This is the world. Look at Singapore. Singapore, and I also put in a table for India. Okay, maybe you also want to have a look at it as well. Right, in Singapore, from the 3rd of January, right, there have been about 1 million confirmed cases of COVID-19 with 1,344 deaths. All right, and also 24th of April, we had a lot of vaccine given out. There's about 13 million vaccine given out and administered. So far, we have a whole population of 5 million. We've got about 86% that has already been vaccinated. In India, I'm not sure how much of vaccination, how many percent of vaccine have been given. Right, from India, there has been 43 million confirmed cases of COVID with 524,000 deaths, as reported to WHO, and a total of a vaccination given about 1 million. So I'm not very sure about the comparison. Maybe you guys want to work on it as well. Yeah, right. So we were prepared, right? We had a lot of discipline, a lot of attitude, a lot of learnings, right? So a lot of challenges ahead of us. So we learned from the beta lesson we had in SARS, right? Starting from the beta lesson that led to about 33 deaths in March 2003. Now that's me in a special tribute, wearing and didn't get to go home during the SARS period, stayed overnight, about, one whole week, never go home. We almost were having staying in the hospital, right? So after this, the SARS learning, we started constructing new purpose-built National Center for Infectious Diseases and started building a lot of laboratories. Right? We expanded the number of negative pressure isolation beds throughout the public hospital system. Okay, we added in more stockpile, pile up all our PPEs and the masks, face masks, and then we established a task force, right? We coordinated with a lot of ministries came in together, right? And a lot of coordination went on. We started building a strong capacity to perform contact tracing, which was very, very successful. And contact tracing makes it faster to actually track the cases. Right? We started training, intensive training, how to use the PPE and all that. So we built more labs, and then we invested in biomedical science, yeah. And we had a lot of expertise coming in to help us with the infectious diseases. Okay, so this was actually our old pavilion, the top one you see here. Right, this is actually the old pavilion. It was look at this picture below here. You can see all in pavilions. It's the old CDC, we call it, Communicable Disease Center. That was the old one. Okay, now what happened? The old CDC was actually from 1913, very old one. So this old CDC, we had a lot of like diphtheria cases, contagious cholera, typhoid, dysentery, plague, yeah. And then the latest one, we also had HIV cases. But we also had a boy, a last boy, little baby boy. If you look at this picture, that's me as well in 1970, very young. Okay, this boy was actually admitted for polio after getting the vaccination. He developed polio virus, and we had to nurse him on this iron lung. I don't know whether you still have iron lungs in India, but this was the last of the iron lung we had. Yeah, so but that was his birthday. We celebrated his birthday. So this iron lung was a very it's a thing that you don't know whether to be happy or don't know whether to be sad, because we lost him after 3 years old. When he was about 3 years old, we lost him. Then after that, we started building the new CDC. Can you see this picture here? Right, the new CDC. In 2018 to 2019, we gave up the pavilion walls. We started building a new CDC. Right, it has got a lot of negative pressure rooms and got a lot of isolation beds. All right. And then we also build a labs inside as well, yeah? So much easier for us to work if we have another. So this is how actually we ended up with all our COVID cases. We plunked them out in CDC in Tan Tock Seng Hospital. It's part of Tan Tock Seng Hospital actually, yeah? And we call it a National Center for Infectious Diseases, right? Singapore is still battling on, even now, all right? We look at the latest data, we shoot up a lot, yeah, and all the way down in April, it just shot up. Okay, what happened here? As of April 7, 2022, recently, total number of COVID cases amounted to 1.1 million. All right, they blame it on the Omicron variant. Sudden expected to rise even further, they said. So what was done? So what happened? We had a lot of lockdown periods, yeah, pandemic in 2020. We introduced enforced hygiene, social distancing rules, effective contact tracing, locked down the offices, locked down the schools, locked down the temples, locked down the mosques, everything, even the facial salon also was locked down. So it became very, very strict, So we were very, very disciplined. People listen, no choice. Okay, Singaporeans are a bit obedient kind of people, right, about all the rules we have. Throw the litter, pass during the lift, also you get the fine country, all right? So, and then, so we started putting a cap on all the visitors, we started locked down the whole country, and then we find that, it was actually helping us overcome this COVID-19 pandemic. And then the closure, businesses were closed down. Yeah, there were a lot of global restrictions to movement. All this affected Singapore's economy. We went through the worst recession of record. Yeah, and unemployment rate also went down. So we started losing people in the businesses. Okay, right. So our ICU beds also was very, very high initially, but then we managed to control it. If you look at it, the latest data has come down very, very nicely. Our daily adult ICU bed utilization. How did we do it? Yeah. Singapore returned to the tighter measures, all right, with the emergence of, we had a fish port. Huh? We have where we actually like a market like that, a lot of fishes, from all the ports we come there. So what happened there was a lot of COVID cases were found there, almost about 1,100 COVID cases. Most of them were all seniors who were not vaccinated, right? So quickly we moved back to phase two. We tightened all our alerts, everything was tightened. And we find that most of these death cases we had were actually unvaccinated seniors. We were losing our seniors very badly. All right. Then we said, okay, let's make sure mandatory. Vaccination must be mandatory. So people without vaccination, we have a gadget where we can, I'll show you that gadget later, where we can track people who have not been vaccinated. All right. So these people who are not vaccinated, they cannot go for some of the eateries, restaurants, or cannot go, All right. So in this way, we encourage people to come in for vaccination. All right. Then our ICU beds came to a downward trend. Right. Right. So everyone got together. All right. And we enhanced all our preparation. We did aggressive contact tracing. All right. As soon as we got one case, the government, we had a lot of government bodies coming in. We started doing contact tracing. Where were you? Were you 2 meters away from a confirmed case? All right. How long were you there? All right. So we started contact until people got very worried. Our own, we find that our privacy was actually breached. But then we realized that this is whether it's, we are a small country and people is so many people here. Either you listen to the government, so they've got no other help, listen to the government and do what we can do to help them out. Travel advices keep changing. I tell you, every month or every week, 2 weeks, we started, the government sent our advisories. Circular after circular started changing and changing and changing. All right. So entry restrictions, people traveling from Hubei to the, after 14 days, they were told to go back and then quarantine themselves. Singaporeans, permanent residents, and long-term visit holders returning from China were placed on 14 days compulsory leave of absence. So we started doing all this. If you look at this picture here on top, it's called a Trace Together. So all of us carry this on our phone, either on a phone, or those who cannot have the phone, they have it on the, we give them a Singapore government actually gave us a free kind of a gadget here where we tap everywhere we go, we tap it so that before you gain entry into that place, we are either that or you stay at home. Okay, so it's a kind of a gantry has been put in there. All right, so this is how we do our contact tracing. Okay, our nurses, my God, we haven't seen the daylight in ages. The pressure on the healthcare workers as COVID became spiking away. Singapore soaring COVID, placing the strain on our healthcare workers. So, and then, our ICU beds already, I've spoken to you about it already. Yeah. There were about the vaccination rates among the healthcare workers in Singapore up to this. MOH tried to increase the ICU capacities and we find that we are tight, our hands are tied. Yeah, so foreign healthcare workers has resigned in big numbers. Our hospitals and our nursing homes, we rely on a lot of foreign workers, Myanmar, Philippines, right, India, right, and Sri Lanka. Okay, and some of them from Indonesia and from Nepal as well. So close to 500 foreign doctors and nurses resigned in the first half of 2021, compared to around 500 in the whole of 2020, about 600 in 2019 itself. Mostly because of personal reason, they want to go back to the country, they want to go back to their family. The whole world was actually grieving in COVID. So, people actually, the nurses, current nurses who are around, who can't go back to the country because sometimes here lockdown, they also lockdown, so they can't go, so they stay with us. Okay, so they were also a bit fatigued as well. Yeah. So, and then Singapore made some announcement, government initiatives. This is the, I want you to listen to this, Steering Singapore. Sorry, things not right. So this was the Singapore's government initiatives, yeah. Let's move on. Right. So there was a lot of support coming in from the government sectors, yeah. So they started giving us a lot of money, especially to support the healthcare costs, yeah. Our Indian nurses from Indian origin were given awards, yeah. That's just the color. And then if you look at it, all the public healthcare workers, yeah, they were given 4,000 Singapore dollars as a cash award for their efforts in fighting against COVID-19. Everybody got it. Indian nurses, Sri Lankan nurses, Filipinos, Singaporean nurses, everybody got it. Yeah. And then, and this is Sister Vasuki, also from India. She's also from NTUC Health Nursing Home. So we had a lot of things going on. So the government helped us a lot. They even gave us free mask, and then free vouchers to eat. And this was very good help from the government. Right. So the government also went on to say thank you for staying home and showing appreciation to all the volunteers in frontline and migrant workers. So migrant workers were our biggest worry because they were staying in dormitories. It's a little bit, staying together. And a lot of COVID cases also went there. So we went in to help them. About 8,000 migrant workers living in the dorms were tested positive actually for the coronavirus. So we started moving on, cleaning up all the dormitories, moving them here and there, until they can quarantine and they come back to normalcy. Okay, right. So vaccination was our another target. We find that we need to vaccinate all our seniors. So they started having collaterals in Tamil. You have to look at it very nicely written in Tamil. So this was all handed out. And then we find that our vaccination rate also went up for the seniors. Yeah. Right. Now we cannot be relying, Singapore cannot be relying only on foreign workers all the time, right? So we need to beef up our nursing pool, healthcare pool. So we started, hopefully, we can recruit. I don't think we can go without foreign staff actually, right? So government initially came up with a new thing called job redesign, the healthcare, something that we want to look forward for. Listen to this
script.
4 community care organizations are testing out redesigned roles to enhance their staff's nursing and therapy skills. They include St. Luke's Elder Care and Rinci Hospital. The job redesign pilot aims to help the career advancement of those in the sector. Senior Minister of State for Health, Kopo Kun, has called for more organizations to come on board. The remarks have come at the Community Care Manpower Awards.
This creates a blended role that can open up opportunities for staff to further their skills and wage progression. With the learning from this pilot phase, we look forward to supporting early adopters in the next phase of our job redesign journey and encourage more community care organizations to come on board.
Over 160 people have been awarded the highest award since the awards started in 2017. Recipients will be provided training, support and opportunities in the sector. They can attend various upskilling programs for free.
So this is one of the projects that I'm also heading, trying to see whether we can redesign our healthcare workers, right? Watch this video. There's also mid-career switch. That means people from another sector can actually join nursing healthcare.
Well, as part of the plan, Singapore's Health Ministry will offer 7,500 new job opportunities in the public healthcare and community care sectors from now until the end of 2021. It says that the jobs are for both fresh graduates and mid-career job seekers as well, and they will help meet Singapore's expanding healthcare needs. Cheryl Goh tells us more.
They've been at the front lines of the fight against COVID-19, helping to keep Singaporeans, ill and healthy, safe during the pandemic. The Health Ministry says it's looking to improve the career development and welfare of healthcare workers, as well as boost their numbers. It's looking to fill 7,500 jobs in the public healthcare and community care sectors by the end of next year. 2/3 of these vacancies will suit those from non-healthcare backgrounds, including support care, administrative and other non-clinical roles. The remaining 1/3 are for healthcare professionals. Those looking to switch to a healthcare-related vocation can also tap on the 200 training places each year under the professional conversion programs for nursing and allied health. At least 100 more places are set to be added next year. Another 1,600 traineeships, attachments and skills training opportunities will be available for individuals to gain needed experience and skills. The ministry says both employers and trainees will receive funding support. It has roped in 7 partners to support mid-career job seekers under the SG United Skills Program, with classes starting this month. One of the training providers is Temasek Polytechnic. It will offer a program in optimal aging practice that comes with practical opportunities at St. Luke's Elder Care Centres.
We are looking forward to having those mid-career workers to come on board to be trained. They always think that it's very daunting to go back to school, but in fact, after a while, they realize that actually it's not so daunting and it's very enjoyable and they learn a lot.
The COVID-19 pandemic has also accelerated the need for the healthcare sector to go digital. The ministry says it's speeding up several projects in the areas of telehealth, remote working, and enhancing pandemic preparedness. Efforts to improve data management and strengthen research and development are also in the pipeline.
So we're trying at every angle to beef up the healthcare pool, right? So this is something that I want to share with you. This is from NTUC Health, where I work from. It's a beautiful.
us with the strategies being used at Singapore by government and healthcare organization to beat the challenges faced during COVID-19 infection spread. Here we have a message from Dr. Neena Khanna, Dean AIIMS New Delhi on the occasion of International Nurses Day. Let's hear to that.
कर दिया आपने मैसेज
Nursing Day is celebrated globally every year on 12th May to commemorate the birth anniversary of the lady with the lamp, Florence Nightingale. Most of us know Florence Nightingale as the mother of modern nursing, but she actually was a statistician and nursing was her calling. The theme for Nursing Day 2022 is a voice to lead, invest in nursing and respect rights to secure global health. And this is exactly what we need to do. We need to invest in nursing to ensure global health so that everybody is healthy. And how can we do that? I think the approach can be threefold. One is that we should encourage nurses to voice their opinion, to be active and proactive not only in policy development but in policy implementation as well. Secondly, to ensure that they are up to date, they are kept abreast with the latest, we should conduct CMEs and conferences for them. Thirdly, I think to optimize utilization of their skills, we should initiate courses like MSc Nursing in Critical Care, MSc Nursing in Medical Oncology, and MSc Nursing, say, in Dermatology. I would like to salute the nurses for doing what they are doing and being the interface between physicians and healthcare providers and the patients. I think on this particular day, why only today, but every day, we should salute them and congratulate them for what they are doing. On this special occasion, I wish them the best in their career and in their life. Thank you.
D.K. Sharma, MS, and Dr. Sanjeev Lalwani, Registrar from AIIMS New Delhi. Let's hear to that.
On the auspicious occasion of the Nurses' Day, I extend my warm wishes to all of you. You have always putting your best efforts. You work hard and you do your job without any compromise and excuse. We extend our warm wishes to you for dedicating your life to the patient care services. Whenever a patient feels better, it is not only the success of a doctor, but also a success for the nurse who puts their heart, soul, and sweat into the patient care services. We may not realize, but nurses are the backbone of the hospital, as they are ones taking every bit of the treatment prescribed by the doctors ahead. Without nurse, the services of a doctor are incomplete because nurses are the one who are always concerned and connected with the patient. A responsible nurse is very important for the recovery of the patient, and we are glad that we have so many nurses who are dedicated for the patient care services and help in healing their sufferings. Not anyone can become the nurse. One has to have a special zeal to become the nurse. They should also have the dedication and selfless attitude. We always feel proud to be a part of this healthcare system as nurse because it demands courage and determination to serve others. The global COVID-19 pandemic has shown the world the important role that nurses play in keeping people healthy across the lifespan. Nurses working at all the levels must also get the opportunity to suggest concerns and requirements to promote patient care. The future of nursing will largely on the technology. So breaking the stereotypes in nursing and harvesting the benefits of technology will help nurses to reach out to the larger population irrespective of location, geographical boundaries, and other barriers. So use of technology should be encouraged among all healthcare settings with all healthcare staff so that we can serve the population of the country even at the remotest place of the country. Promotion of specialties in nursing is also very much helpful in developing a specialty-based nursing practice that can also shape the future of nursing as well at high level. On this day, we acknowledge all the contribution made by the nurses in patient care. Despite working through challenges and challenging circumstances, nursing staff around the world continue to go above and beyond to deliver highly skilled, safely critical care to patients every single day. On this occasion, I extend my warm wishes to all of you from the academic section side.
Hands that turn caring into action, touch that turn compassion into comfort, smile that's turn love into healing. That is nurse. International Nurses Day is celebrated every year on May 12th in the whole world. It is observed or celebrated each year to mark the contributions that nurses make to society. We know this year the theme is Nurses, a voice to lead. Invest in nursing and respect rights to secure global health. Nurses are at the forefront of global healthcare. They provide individualized healthcare, but they also educate, innovate, and advocate for the health and well-being of whole communities, whether it is in international setting or in their own backyard. By thinking globally, nurses have the power to move mountains. Nurses are unsung heroes of medical field. They know only provide the day-to-day care of hospitalized patients, but they also perform tasks few others are willing to do. They care of patients in every way, handling infections to talking down irritable family members. Now, in these days, the pandemic has shown us only too clearly that we need a real investment in the profession of nursing in order to secure global health. A nurse's rights, safety, and well being must be protected as well. The nurses' shortage is a serious threat to public health and must be addressed now. Our nursing leaders can become a voice to lead by talking to governments, community leaders, policy makers, and investors. WHO report sharply outlined the need to invest in nursing in its
Thanks. Over to you, ma'am. Thank you, Mamta. A very good afternoon, everybody, online and off, all those who are present online as well as offline. Respected dignitaries, Dr. Lata Venkateshan, Professor cum Principal, College of Nursing, Dr. Man Singh Sidhu, Mr. Mirza Shadan, and Dr. Deepika Khaka. It is my proud privilege to deliver a vote of thanks on behalf of College of Nursing on this International Nurses Day, that is 12th of May 2022. I extend my hearty thanks to Professor Randeep Guleria, Director AIIMS, for being a part of this program with us today morning. Thank you, sir, for sharing your motivational message with all of us, for all the nurses across the globe. I also thank sir for facilitating us for organizing this program. My heartfelt thanks and gratitude to Dr. Lata Venkateshan, Professor cum Principal, College of Nursing, whose under able guidance and leadership we have organized this program successfully. Ma'am's vision and dedication is highly appreciated. Thank you, ma'am. I extend my heartfelt thanks to Dr. Deepika Khaka for coordinating the program with all the teams. I also thank each and every faculty member of College of Nursing who have been working day and night hard to organize this program behind the screen and in front of the screen. I express my gratitude to Dr. Man Singh Sidhu, who had come all the way physically to us and address us and sharing his ideas on Norwegian collaboration opportunities for nursing. The opportunities discussed were eye-opening. Thank you, sir, for the invitation to Norway also. I express my gratitude to Dr. Shama Akers, Dean and Professor, Liberty University School of Nursing, USA, who shared her opinion about changing the world by investing in nursing. And that is the need of the hour also. Thank you, ma'am, for emphasizing on trust building in nursing. I also thank Mr. Mirza Shadan for being physically present with us and sharing his ideas on global health strategies. Thank you, sir, for enlightening about the advocacy of nursing. I express my thanks to Ms. Meeravati PS Educators, Singapore, who joined us online and highlighted the challenges faced during COVID. Thanks for highlighting Singapore tourism as well. I also extend my heartfelt thanks to all those special people who have expressed their greetings online and messages online. That is Dr. Neena Khanna, Dean Academics, for sharing her message and best wishes for nurses across the globe. I also thank Dr. D.K. Sharma, Medical Superintendent AIIMS, Dr. Sanjeev Lalwani, Registrar AIIMS, for sharing their greetings. And my special thanks to CNO, Mrs. Kamlesh Chandelia, who as a nursing representative has shared her wishes with all of us.
It will be a failure on my part if I forget to thank the set facility staff for their technical support, AIIMS cafeteria for providing food and refreshment, all the support staff from College of Nursing for their tiring efforts which are not visible. Last but not the least, I thank all the students, the delegates, and those who have joined physically as well as online for attending the program since morning with us. Thank you all from the bottom of my heart. And I thank everybody whom I have forgotten also. Thank you, everyone.
Can we have a brief? All of you can come.
Thank you all who have joined online. With this, we end this program.